Our next guest is part of a bipartisan group of lawmakers pushing to prevent the Obamacare subsidies from expiring at the end of the year. Joining us right now is Congressman Josh Gottheimer of New Jersey. He's a member of the Intelligence and Financial Services Committee. He's also the vice chair of the Problem Solvers Caucus. And Congressman, welcome.
Thanks for having me.
We have not heard a lot of bipartisanship recently. We haven't heard a lot from the problem solvers because it seems like things have gotten really pretty dug in D.C. Is that a misconception from here, or is that really the way things are?
No, it's definitely more of a circus than usual. But
that's saying something.
That's saying something. But the good news, which I think is good news, is there's still a bunch of us who are actually focused on working together and getting stuff done, including on finding a way out and way forward out of this mess on health care, where you've got people facing health insurance premium increases in January. In Jersey, if we don't do something about extending these ACA tax credits, family of four's insurance premiums will go up $20,000 in a year, 175%. It's 30% of their income. I don't know how, and people keep coming up to me, in the grocery store, at diners, and saying, I just got my notice about how much my health insurance is going up next year. I can't afford this. And so, like millions of people, they're just going to either drop their health insurance, they're going to move to another plan that's going to have huge out-of-pocket costs, or they're going to have to give up some of their doctors and other people they need to see. Or you've got literally 22 million Americans whose premiums will go up in the country and 4 million who will just drop it. So that's not a good solution. We've got to find a solution. And so a group of us are working together to do that.
I'm going to ask more about the group and what's going on with it. But look, this is a situation where something needs to be done. The Republicans have said we're not going to pay $350 billion over the next 10 years for this. But is there something where you can extend the subsidies now and in the meantime try and get at the reason that healthcare inflation has so far outpaced inflation, broader inflation?
So a lot of the discussion is exactly what you're talking about. And, we're still negotiating, so there's ideas going back and forth. But you're looking at either a one-year extension, or a lot of people are coalescing around a 2-year extension and saying, OK, year one, we'll do some fixes. And year two, let's look at other major changes that we might be able to make to get overall costs down. Some of the ideas being talked about are capping, from an income basis, capping those who would qualify for the premium assistance, looking at taking on fraud issues.
Anybody making more than $200,000, a family of four making more than $200,000 would no longer.
So depending upon some of this stuff being kicked around, and again, we're all just going back and forth, but either from 600% of poverty, 1,200% of poverty. So depending upon how much you make, having certain caps in place so that you wouldn't get extra assistance, looking at going on after fraud. There's a lot of claims, especially from some of my friends on the other side, who look at it and say there's people who are getting signed up who didn't know they're being signed up. So what can we do to actually stop that?
Because
so those are some of the things.
They have no skin in the game. If you don't have anything that you have to pay at all, whether it be a $25 copay or a $10 copay or something along those lines, Republicans have said,
yeah, you should have some skin in the game.
To get rid of the fraud that comes through with them.
So some people have talked about that. Should you pay $5 a month, and should we then have a pool for people who can't afford $5 a month, because you want to go after the fraud, not people who actually need the help. So those are other, some of the ideas being talked about. Then you have longer healthcare reforms like PBM reform that's being discussed. I think Senator Cassidy was just on.
Senator Cassidy was on yesterday. He was talking about the creation of health savings accounts, that you could put the money in a health savings account and kind of spend it yourself, so that the consumer has some control over what's being spent and where. And maybe that gets at some of the there's a lack of transparency in healthcare cost. If the consumer has control of it, maybe that brings some down too. What is the thought within the Democratic Party of that? Because it's been a big issue that Republicans have pushed.
I think here's the good news. We had a discussion last night with dozens of members of Congress and some senators. We've part of this ongoing discussion after I led a letter with 32 of my colleagues, Democrats and Republicans, saying to the Senate, hey, you should probably include the House in these discussions, right? Why don't we have and not just one party, we should have Democrats and Republicans sit at the table and try to find a solution, because, there will be a guaranteed vote in mid-December that the Senate agreed to give Democrats on health care, right? That should not be a part, right? The key, right. So one, that should not be just a partisan show vote where you get just some Democrats. The idea in my mind is, why don't we actually get everyone to the table and vote on something that you can draw Democrats and Republicans and get enough votes to actually come to the House, and then let's have a vote in the House, right? Right now, so far, the Speaker has said we're not going to have any vote on health care in the House. To me, that's ridiculous. Like, let's put up a bill, Democrats and Republicans, that we work on together, and let's vote on it and actually solve this problem instead of playing these continued games with it.
Our sister network, MS Now, is reporting that President Trump has delayed a planned announcement of a proposal to extend those Obamacare subsidies after pushback from congressional Republicans. There's still a chance the president comes in and says, OK, we're going to extend this.
Yeah, the good news yesterday, I thought, even though he then backed off it, as you just talked about, the good news is that he talked about, for the first time, extending these premium tax credits to help people with their health insurance payments. I think, hopefully, they realize it's not a good thing for Christmas to have in people's stockings a huge increase in their health insurance premiums that they can't afford next year, on top of what they're paying for the tariffs, on top of what they're paying for food and childcare, right? Everything is too expensive. We know that, right? It's why we are talking about how important it is for affordability. The election a couple weeks ago was a sign of people saying, wait a second, I can't afford anything right now. My health care, my food, my energy bills, it's all too much. You guys have to do something about it. So what we're doing, again, to actually solve the problem is Democrats and Republicans talking to one another. I'm hopeful we'll put out either a bill or a framework coming up in the next days and put something out where it says, building on what many of us have already done with legislation, saying, here's a solution we can all get around. Is it perfect? No, for everybody, but I think it's a great consensus.
Would the Problem Solvers Caucus speak with the White House about that, too, if it sounds like there's a similarity in the plans they're pursuing and you are?
Sure. So, in fact, many in this group, some in the Problem Solvers, some beyond the Problem Solvers, this big group that's come together, has said to the White House, hey, talk to us anytime. I've offered to the White House, many of us have. We're happy to come in, and the president offered this, right? He said, when we get past and open the government up again, I'd love to have people over for a negotiation. I'd love for the president to have us over for a negotiation. Let's discuss these things. We are finding consensus in our group with Democrats and Republicans. A bunch of us want to solve this problem, love to have the White House involved, and let's all talk about this.